Should I try to go to the other?
Okay, so I need to go over there to make sure.
Well, because
Two ideas out.
it's it started at here.
That her mother told her, which is kind of
Hello. Oh, now is this supposed to be moved?
Good evening.
Good evening. So this is Muluso from African Services on behalf of Paula Roche.
Go
I
ahead.
muted. Okay.
Go ahead.
So let me unmute. But see there.
So is it coming from her tablet or from the app? How can we keep it from reverb? Are you
I was muted at first.
okay? Mute yourself, Laquita. Good
Okay.
evening, everyone. Can you hear us?
Yes.
Yes.
Okay.
Okay.
So if she mutes herself, they can hear her.
Yes. And you're okay, Heather, with yours? Okay. Hi, everyone. Just a
Thank you.
little technical difficulties again. But thank you for being so patient, and hanging in there with us. The meeting will now come to order at 6:38 p.m. We're gonna try very much to be out by 8:30, no later than 8:45, but hopefully 8:30, we're gonna push for that. So we're gonna try to stay on the time constraint. At any rate, happy Black History Month, to everyone here, and beyond. But we're gonna continue the traditions that have been, established. And we're dealing with a whole lot that I'm sure will come up in discussion a little later, as it did last month. I am now there. Let me get a motion to call the meeting, to accept the meeting being called to order and accepting the agenda. However, I realize that before we accept the agenda, I have revisions to the agenda. Let me pull that up. The revisions to the agenda, under announcements, we're adding the Community Research Forum on Wednesday, February 26th. Sandra Harris, our community partner and vice president at Columbia University Irving Medical Center, will talk about that. And then under presentation, we have the Director of African Services Committee speaking, Mr. Muluso Bekele, and he will correct my pronunciation if I just learned this evening. But we have a new printout. It's just that it was too late to send it, so it's just on my computer. Also, a third grantee, Liana Reisner, who's network director for Plant Power Metro, is added under district program issues. And I have for New York City Department of Health and Mental Health, excuse me, Ms. Cheyenne Murillo from the Department of Health. So those are the changes. Is there any other change or adjustment to the agenda? If not, can I get a motion to accept the agenda as presented, as advised?
I said accept, I move to accept the agenda with changes.
Second. Okay, so it's been properly moved and seconded, Monique Carter Cordero moved and, seconded by Michael Iglesias. See, it went on.
Thank you.
So Michael, you did such a beautiful job with our minutes last time. Thank you. So, do you mind taking some notes, this time for us? Thank you so much. So we heartily thank Michael Iglesias. He's our newest member, not only to the community board, but to our committee. And this will be his third set of minutes that he will have done for us upon the so I don't know if members of the committee have read the minutes. They were sent out earlier this week. I hope that you have. If you have or have not, we can still move on the minutes based on how we usually do it. If you want to accept it, I added the last two segments of it.
I have one minor correction. It's very minor, but Miriam Aristide Ferrer is listed as a public member and she's
Oh, yes, Miriam sent me
so that should be
a note on that.
corrected.
Yeah, I had told Miriam, Edwin, and Monica, basically all three of them have been a co-chair of this committee at some point, and their expertise, comments are invaluable. And so, didn't know, there wasn't really a place to put them, because I know they're really heavily involved right now.
Right, but
I'm
Miriam's
still a member.
who's on the board, that's
I'm
why.
still on community. I can't be a public member if I'm a standing member of the
Gotcha.
board.
So she, that's
Gotcha.
correct.
So I wanted some kind of special thing, but we'll find, thank you, Monique, for that. We'll find another way to list it and have that corrected. And the other two are public. But I want to do it in such a way that you don't get.
Laquita, I'm not a public member. I'm a member of the committee. I've always been a member of the
No,
committee.
that's what, just correctly, you may not have heard. So we'll do it in such a way, especially because we don't want it stated that, oh, all these meetings and da 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 da. So it's a courtesy that it's a courtesy that you're coming, and so you're. No, I'm talking about the committee.
Okay,
It's a
I think
courtesy.
I think she thought.
Wants to fully,
all right,
she wants to fully come into the committee again too. So it wasn't listed, so that has.
I never left the committee. That's my point. That's what I'm trying to
Right.
here.
Yeah.
I took a leave of absence, and
Yeah.
somehow I was removed from the committee with
Right, so we have.
listed as a public member, and I've been part of the committee for many years, so I'll start attending in person once I'm listed as a member again.
Yes.
Okay, well, I'll see how we go about doing that, but I know I personally and others welcome seeing you and having you here and your expertise. Thank you, Miriam.
Thank you, Laquita.
Okay, all right, so next on, okay, is the minutes, so we'll make those corrections to the minutes about public.
The minutes, is it just one page front and back?
Agenda.
No, I'm talking about minutes.
The minutes
Because
should be,
the two pages I have are the same.
Yeah,
okay, maybe you just didn't copy. Oh,
yeah.
you have it, it might be that way here, but you have my, That was 4 pages?
Yeah, it's the same thing.
Just repeated,
Yeah.
but not on my notes. You can maybe what you, but just look at the one. If you want, we can vote to accept by, during the week, I'll do, ask for your comments and you can respond to it.
I mean, if it's the same thing, then we're just looking at.
No, I had, what I said is,
Oh, okay.
3 or 4 pages.
Okay, got it. So we can maybe do it offline.
So just, I sent those by email a week ago, yeah. So you just have, it's just the way it got printed.
Right. Yeah, thank you.
Mhm.
Yeah, I was trying to pull mine, cause
All right.
I printed it. Oh, wait a minute.
Okay. All right, so, let me just mention with the, did I conclude what we're gonna do with the minutes? We'll just just formally indicate that we'll get feedback from the members, on acceptances or changes to the minutes, by email this week. And so they can be,
All right.
voted on by email.
The assumption is they're minor and then we'll make the correction pertaining to them.
Okay, you wanna make that?
Yes, so I motion that we accept the minutes with minor changes. We'll do it offline. But it will be noted that Miriam will be, her status will be changed from public member. And she is a part of the board. And so we can discuss further about her being a member of health.
Well, anything that is.
Right,
right
but
on
she
the
isn't a
minutes.
public member, so we have to make that correction. That's all.
And any other correction that you might see in the minute. Second, can I get a second?
Second, somebody,
I
so we can,
Miriam, second.
thank you.
All those in favor?
Aye.
Okay. All right, so I'm moving to announcements. I ran into, Arnold, connected to, from public affairs a couple of months ago, actually in December. And then Victor had a conversation also. So, she wanted our health committee to be part of the Columbia's community health. So that was fine by me. I kind of think it would be different from what we presented last year, but maybe we'd have to find another location. Because a health fair, we could bring the community partners in, and then they can have their brochures, blood pressure checks, all of that, as well as Columbia has, its own community medical center. So with Dr. Janavi, anyway, I always get Dr. Janavi's last name turned around. However, so I thought it would be good if we did work in conjunction with them with that. What we could do is present to the community some very basic stages of life and what they need to have checked or be concerned about as it concerns preventative health. For example, for children, what children need, they're talking about vaccinations, even talking about whether or not you're against it, but have someone come in and be able to then on how to keep your child at certain ages fit and in good health. Additionally, the next stage, perhaps adolescence, and have a session where teens and young adults are, have an opportunity to hear about the kinds of things they could be looking out for as they're growing and learning about their health and keeping themselves well. Beyond that, of course, there's maternal health for the mother, at that phase of life, if there are women and men who are starting their families, and what they should do to take care of their body. So basically a stages of life way of participating in the health fair. That's part of my thinking. We're having a meeting. One meeting was set up and canceled already this week, so hopefully that can get off the ground. And then as we present our forum as we had done it last year, perhaps that was really different in that we had people talk about research and what is involved in the research of certain health topics, what it means to our communities to know about this information, and how they themselves can be involved in research, participate, so that we have the data, the information that we need, and so that researchers can then say, okay, we can pharmaceutically develop this medicine or other that's going to really have an impact on people of color, brown communities, Black communities, Asian. So I think with our focus on research and professionals, which was inspired by Columbia's forum that I had gone to, but we wanted to really add that component of what you need to look for if you're going to participate. So that's kind of a summary of where we are. Nothing's etched in stone yet, but
when are you planning to meet with,
they changed it just this afternoon, so hopefully
Well,
I'll let you guys
let us know
know.
so we
I think
can
you're
join.
setting it up.
okay,
Yeah.
but
So
the goal is to do it with them collaboratively?
Now, I don't think they have a date for their spring community health fair. Yeah, I don't think they have a date yet, so that's, although we need to know in advance if we're gonna get people. So that's why I think if we kept it a little simpler, like the stages of life, that would make it easier in case they at the last minute have when I say last minute, that could be 2 months, and that still is kind of last minute, because sometimes the doctors take time to schedule Saturday. So to be continued. Heard about it. This is probably my third time mentioning. Really cool. Total surprise. Now, Sandra Harris, our community partner, our vice president at Columbia University's Center, Irving Medical Center. I see you, so it would be great to have you present your big event, the Community Research Forum on Wednesday, February 20th.
Yes, good evening, everyone, and thank you for having us. And Diego from my office is also here, so he'll share some other office updates. So I wanted to present on our upcoming Community Research Forum that will take place on February 26th from 6 to 8. And it would be on our cannabis, opioids, and fentanyl research. It's one of the topics that both community boards 9, 10, and 11 have brought to our attention. So we have identified 2 of our faculty in the Department of Psychiatry who have done extensive work, research on cannabis. And what we also wanted to do for this forum is really incorporate some of the community policies and engagement activities. So we've also reached out to Department of State's Cannabis Management Office. So we are going to have a representative from that office also addressed us, Catherine Diaz, who's the Deputy Director for Community Affairs for cannabis management. As you know, there are a lot of questions in terms of the application the policies around cannabis in the community, but we definitely wanted to contribute on the research and clinical implications that our scientists have identified and have been working with. So we sent out the mailings. They just went out today. We want to encourage, everyone to participate. The forms are translated simultaneously into Spanish, so we will have that available. And the format is usually we have the faculty and the panelists present on their research. There's a Q&A immediately following their presentation. And then there's also an opportunity at the end to connect with the faculty and learn a little bit more about their work, and the same with our community partners as well.
I want to just ask Sandra, at the time that I learned about it, I did mention Monique and Miriam's names as being our task force co-chairs with on the topic of cannabis. So we're certainly hoping, I get, obviously you're going to use the Columbia medical professionals that they have there, but
I RSVP.
Yay! Wonderful.
Thank you for sharing,
yeah,
Lakeisha.
I sent it.
Yeah, and Laquita, I think also the
didn't
goal
see it.
is, I think it's important during our Q&A to have those individuals in both boards that have been engaged, that have a sense for the questions that our community is asking, so that we can ask that. And one of the things that we also do during this forum is really invite our local media, because there are ambassadors in the community, and to the extent that they can share, some of the questions, some of that feedback, we can help sort of get more information into our community. I know we received a lot of inquiries from parent coordinators at our schools, the whole legality issue when you're working with with youth and young adults, how to manage that. So I think that we're going to need a lot of the experts in the room to really answer some of those questions. I think the researchers can speak to the science, which is something that is in a lot of people's minds. And also the public policy in terms of the management pieces, but definitely in terms of how all these translates in our social environment. It's up to trusting the leaders in each of the community boards to be there to really be able to put forth some of these suggestions, recommendations, and truly some answers for our community.
Sounds great, Sandra. I didn't see it yet, but I'll certainly sign up as well. Miriam and I
I'll be there.
we'll be there. We agree with everything that you've said so far.
Excellent, excellent. And I want to make a point of that, of letting people in the room know that you are there, because there has been a lot of questions that have come up.
Yeah, rightfully so. So we understand.
Apart from community leaders, who else are you looking to have in your audience?
Sure. So our target audience for the community forums is really lay audiences. It's our local community. It's our residents. So this is going to our parent coordinators, to our parents at our various schools. We also have email lists that we send out throughout the community. So I always get a little nervous because this is a hot topic, but hey, if we are in a standing room only room, then we'll have to get a second room, or maybe decide that we're going to repeat the forum a second time if we get a huge turnout. But really, Miriam, the audience is really lay audiences. It's really our local residents, because one of the things that I say, if we're coming to these meetings, we're already engaged. So we want to make sure that we tap into our local residents, because they're the one that are having, the tough questions and are concerned as to where to go for answers and guidance. So I say to people, your building tenants, residents, tenants association, that is the target audience. And we make a special effort to make sure that our faculty is translating those research findings in lay terms. So trust me, we vet their slides presentation. Monique knows.
Thank you. Thank you so much.
Yes, and with Sandra, I think you actually sent a flyer. Sandra had asked us our committee, it really would be, not just a committee, it would be the board. I mentioned it to Victor. He wanted us to co-sponsor, this. Is that still something, with all the community boards or just,
Yeah,
how did you-
that is still, we started sending it out. So as soon as you say it's okay, we'll add your names on it. I think especially with CB9 and CB12, I can say that I've seen the feedback in writing of folks just asking and wanting more clarity, which is why I emphasize on having a representative from the state join us, because it should not just only be on the boards, but we're all looking for guidance when it comes to the implementation. I could bring the research, but we need to know, how does this play out in our communities?
Okay, and so I did email, everyone really has to check their email, we're all getting a lot of it.
I
But
know.
I forwarded that email to our committee members and beyond, our number of community partners too. So you
Yeah.
just have to kind of.
Yeah, I didn't get the email. I'll get that
Yeah,
there.
and I would say, Laquita, and to the committee, thank you so much. And I think now more than ever, we need those emails continue coming in, because it's with a lot of good information. I was just checking your latest email, like, oh, I need this resource. So to share with our CBO. So I know it's a lot, but we need to be able to take in more information to get it out there.
Exactly, and I always say community partners, but I'm sure there's probably one or two things that may not have gotten out to people because it could just get lost in my email folder. But most of the time I am forwarding materials to the committee because it's really important information for you to see. Because it's really, there's so much as it concerns health and the environment. And we can't cover everything at every single meeting. So it's great when we have a partnership and you have the information, you know, what you as committee members and, you know, our community residents. All right, thank you very much. Are there any other questions for Sandra?
I just want to verify that, the program, it will cover the pros and the cons. So it will be balanced, the information that will be provided to the public.
Did you
I'm
hear
sorry,
that?
if it will cover which referrals, I mentioned something else.
Will the information be balanced, covering the pros and the
The
cons?
pros and cons of cannabis from
Yeah.
your medical.
So one of the things with the research is we're going to give you the research findings and what it says, right? And in that, I'm sure that our researchers would highlight what those pros and cons would be, right?
And the
So we'll
impact,
definitely emphasize that. Yeah.
and the impact on, you know, secondhand.
Did you hear that?
No,
And
no,
the
I'm sorry.
impact on secondhand contact with cannabis. I know we've done it.
Yeah, I think those are
Yeah.
I think those are the great questions for our researchers. I can tell you, one of the faculty that's presenting on her work, I was pretty impressed with the whole research process. So I imagine that she will be presenting on all of that. I mean, these are individuals that have established their career in doing this research. So I think those are part of the Q&A. And some of the questions that we can ask.
Okay, thank you.
Yeah.
And so just to repeat, it's Wednesday,
February 26th
26th,
from
6
6 to 8.
And you know what I did not put on the agenda, and I'll send this revised agenda to everyone, is the address. Because I'm not sure that, I didn't pull it from the flyer that I saw.
Yeah,
People have a
I'll
flyer.
send that over to everyone, and you will see the mailings coming out, and so we'll be able. It's right on 168th Street. Mm-hmm. 560 West 168th Street. It's at our School of Nursing.
Oh,
Okay.
okay. It's a wonderful facility too. And you know,
It's where we do our naloxone trainings. Yeah.
And just to repeat, they do have translators Is it how many languages for the translation?
Well, right now we have in Spanish. That's one of the things that we need to expand. So we have a company that does the simultaneous translation. So at the end of the forums, what we also do is provide a survey to kind of get a sense from the lay audiences that's attending what other languages we should be translating in as well. That's key.
All right, thank you very much, Sandra.
Ways.
And,
And I gotta jump off to a CB12 meeting on DOT. We're gonna
Okay.
get after them and those.
So we'll see you on February 26th.
Yes,
and,
you'll see me before then, yes, but definitely on that day.
Okay, thank you again.
Bye-bye.
Cheyenne, I know that you are here and I greatly appreciate it. I just sent out this evening something I saw from you earlier today as well on immigration and what people should know about immigration. So everyone, the committee, and I didn't send to the entire 70-something list I usually do, but there were a great number of people who did receive it, and I will send it out again. But Cheyenne, you had wanted to talk to us about a couple of things, and you were always welcome here. Cheyenne is with the Department of Health and Mental Health.
Yes. Hi, everyone. Thank you so much for allowing me to speak tonight. My name is Cheyenne Merlo again. I'm at the Harlem Bureau of Neighborhood Health with the Department of Health. You might know it better as the Action Center over in East Harlem. And I'm just going to briefly share a couple of things that we have going on. So for folks who don't know, the Action Center is in East Harlem. It's on 115th in between Lexington and 3rd. And we have a variety of services there, including our family wellness suite, where we just actually got a new shipment of combination strollers and car seats. So mothers come in and they can be trained on how to use the car seat. If they have a car, we can help them install it as per the protocol. And then they receive a free car seat and stroller. And it's great because the stroller and car seat can be clicked in together and taken on the subway. Whereas before, they had to carry the boxes and it was a little bit difficult for expectant mothers to do that. So it is able to be transient. Along with the family wellness suite, we have our bilingual programming where mothers can come in and be social with one another. They can talk with their babies, can socialize and all that stuff. And then we also have maternal yoga. Aside from the family wellness suite, I myself have been leading a couple of programmings. One is for, it's open to everyone, but it does focus on immigrant communities. I host fairs every month where we bring in health insurance navigators, vaccinations. We offer free clothing from time to time. And that is actually happening next week on Tuesday, February 11th from 10 a.m. to 1 p.m., where we'll be offering legal support, healthcare navigation, common pantry navigation, things like that. Also, we'll be giving out 100 hats and gloves as well, so folks can stay warm. So that's February 11th from 10 a.m. to 1 p.m. I haven't sent the flyer out yet, so that's coming. And then the last thing I wanted to mention, well, two more things. One being that we have a space on 137th and 5th Avenue that has been, we're allowed to use it again, which I know is closer to CB9. So one thing that I've been trying to do is host Narcan trainings out of that building that's more in West Harlem or Central Harlem. So we're able to host Narcan trainings there. If it's more accessible to CB9, we're happy to do that. Again, it's me doing it, so I'm pretty flexible. It can be in the evening, whatever is most accessible to folks. I can work with you on that, but just wanted to make it known to CB9 that we're able to use that space a little more now. So that's really exciting. The last thing is just, as Lakita mentioned, the immigration policy and health virtual session that DOHMH is leading next week, also on Tuesday. That immigration and policy health virtual session is going to focus on, just as the title says, policy and health information in the new administration. And that session is not for community members. You can share it with community members, but it's going to be more focused on community-based organizations, faith-based organizations, and how they can prepare themselves amid the new administration as far as immigration policy and health. So I know that's a lot of things. So thanks for bearing with me there. If you have any questions, more than happy to take them. And I'll also include my information in the chat. Thank you.
And so ones that I emailed to are connected to there are community partners. They're connected to other organizations and probably host some undocumented persons as well, so that they need to know. And everything's been, of course, it's an uproar and some chaos, some buyer's remorse, and all of that related to what is happening now with, I'm not sure it's policy, it's just some executive actions. But to what extent is DOH holding, are there any programs or program information that you're required to hold back information on? Because I got something from one of the DOH groups that indicated that they're doing a temporary pause in coming to community boards because, just a temporary pause until, and it's understandable, I guess. But to what extent are programs, to the best of your ability, Cheyenne, are being paused?
Yeah, that's an interesting point. I haven't heard anything internally about pausing communications with community boards or other like government entities or CBOs on my end. That's something that I can funnel up to our assistant commissioner, Padmore John. But as far as like service delivery, as far as I know, everything is going on as it has been. The clinics remain open. There's been no stated impact on as far as federal funding on the health department thus far. Everything, our commissioner, Dr. Michelle Morris, has said that we're business as usual. So I'm not really sure on that actually, but as far as I know, again, we're business as usual.
And that would be, that's good to hear, but we did get something in writing from one of the areas, DOH, saying that they are having to put a temporary. So we'll try to get more information to the extent that you can steer me in the right way. And of course, Padmore John is our former board chair, and he is a former chair of this, co-chair of this committee. So
I'll ask him. I'll definitely.
Yeah,
I'll for sure ask him. It could be that it hasn't trickled down to the Bureau of Neighborhood Health, which is interesting because we are so community facing. But I'll definitely ask him. That's something that we should absolutely be aware of. I'll ask him and I'll get back to you.
And the other reason to this is just general, is that I'm looking to try to do some proposal. I'm not sure. I need to hear what's coming out of federal government, and I know it impacts Columbia University and therefore our community, NIH and NIH studies. So I've been looking at some, hearing right now mostly things on the news and trying to see how that impacts us and what it's like for certainly health organizations, viruses, or just U.S. polling. That's the best pulling out. So there's a lot going on.
Absolutely.
And it impacts us, but it's just chaos.
So it's a question, we don't see on the agenda. We're gonna go into that in more detail.
Which one?
It says special presentation.
Yeah, I was hoping, yeah, we could. Good. Any questions for Cheyenne? And thank you, Cheyenne. You know how to reach me directly. Any other questions? As I mentioned, I did email out the immigration form issue. I don't know that I did for the maternal health. So if you have the other two workshops and flyers, just let me know, or just send them to me again. Just in case I missed.
You didn't. I didn't send those. I will send
okay.
You didn't miss it.
Okay. Okay. Any question in terms of information that you guys would like to hear from Cheyenne? She's extremely resourceful. COVID-19 materials and all, you still have,
We have, sorry.
I said we could possibly get from
Yeah.
you.
We're low on test kits right now, but I mean, hope we don't know that we'll be able to get more, especially now with the administration. But we do have plenty of masks. So if people are interested in masking, we have plenty of those. And then we also have hand sanitizers as well. And then always literature is available too. So that's kind of what we have right now, just minus the test kits. We don't have many of those.
Okay. Is that something that you guys will be replenishing?
Actually, I'm sorry, I just had a thought right in that moment. If you would like to order test kits in bulk, we actually do have a resource for folks to do that. So your organization, including CP9, can put in a bulk order of like 1,000 kits, and with a central office that I can submit the order to on your behalf, and they'll deliver them to you. And to my knowledge, that is an ongoing resource. So, yeah.
Perfect. Let me know if there's some hands are up. Heather, are you good at that? If you see some hands up that I don't see, or if your hand is up, or if it's been up a while and I miss it, just don't hesitate to just speak up. Okay. Thank you again, Cheyenne. As everyone knows, the West Harlem Development Corporation provides grants to qualifying agencies, services in our, I'll say in Harlem primarily, or certainly if they're not based in Harlem, particularly provide services to District 9. And back in December, we had 2 among the 12 that were honored receiving grants in the area of health and human services. Last month, we heard from 4 of them. So altogether, right now, we've heard from 6. Tonight, we have 3 additional, and hopefully I haven't missed one because there were some name changes and representative changes this evening. So hopefully I have only 3, but if there's a 4th who had wanted to present tonight, just indicate and let me know. But we have 3, and let's start with African Services Committee. Muleso Bekele, the director. And correct me if I mispronounced your name.
No, yeah, Muluso Bakal. You got it.
Okay.
Okay.
Welcome. And so let us hear about African Services Committee. We're asking that you keep your presentation. We always say 8 minutes, but it could be less so that we can spend a little bit more time with Q&A. Okay. So I'm going to have to time you this evening. Okay. So you can begin now. Thank you very much for coming.
Okay, thank you so much. The West Harlem Development Corporation funding enabled us to expand our pantry services. We already had a pantry service, but this funding enabled us to hire a pantry assistant, purchase a commercial deep freezer to store and distribute Thanksgiving turkey, chickens, and store perishable items, and install additional shelving to store food pantry items. It also increased services. So we were able to enhance food pantry distribution in CD9 for an additional 15 clients per week, increasing the total clients per month to 274. The 5 largest zip codes we served were 10025, 0026, 0027, 0030, and 0031. And we were also able to enhance the variety of food in the pantry bags. We were able to add 400 nutritious frozen meals to clients who had limited access to functional kitchens. And were able to supplement with fresh bread donated by Ora Schwartz Bakery, which we get fresh bread donations on Wednesdays. So each pantry bag contains protein in the form of frozen chicken, ground turkey or beef, tilapia or salmon, dairy as shelf-stable milk, grains such as bread, rice, pasta, cereal, and oatmeal, vegetables, canned vegetables, collard green, frozen mixed vegetables, and fruits, diced apples and pineapples, dry raisins, orange apple, and grape juice. In 2024, we distributed 1,701 pantry bags, which is about 8,505 meals, with each bag containing about 5 meals. And oh, it's a picture, so since I'm not doing it. So our hours of operation are Monday through Thursday, 10 a.m. to 4 p.m. Our phone number is 212-222-3882, and we're located on 429 West 127th Street, second floor.
Can you drop your information in the chat?
Sure.
So
Sure.
now, I just have a question. How have your members or constituents been impacted by the immigration and deportation issue?
At this point, it's more fear of what's going on and not knowing what could happen. So yeah, they're very concerned, and to the point where some clients won't be leaving their homes or won't take their children to school.
And is there someone on staff though that you have that's specially charged with assisting?
Yes, we have attorneys.
Oh, okay. So they have attorneys.
Any other questions? Anyone else?
Right.
Yes.
What about the children who are not going to school?
Did you hear that, Lou?
I'm sorry, I
What about the children who are not going to school?
Yeah, the parents are scared of like going out, so they're
Yes,
keeping them home.
Right.
Yeah.
Are the schools showing support, any prevention or some resistance, proactive kind of resistance? Because I heard that is happening in some areas in Harlem, but I know your population may be coming from other areas of the city, depending on where their housing is.
Yeah, I mean, it's mostly from the Bronx, but the schools are supportive. It's just the parents are really worried. So they're keeping their kids at home. And so we try to encourage them to not miss schools for the kids. I mean, it's justifiable. The fear is it's at a very high degree of fear. So we try to encourage the parents that they shouldn't keep the kids from school.
Cheyenne, if you could drop your information in the chat, Maluso, will you take down that information? And then maybe Cheyenne, I know I forwarded the information on her immigration segment that's taking place next week. But I think you should reach out to just engage with as many resources as you can, I know you have attorneys, but they're working with so many people, just trying to see
Yes,
the information that you can get from Department of Health as well.
that would be great.
Were there a couple of other, I think, was it you, Monique, who also
No,
had your hand up?
no, I think that Clotilde was getting at what I was thinking about my concern in terms of children and what's happening.
Michael, did you have your hand up? I thought you had your hand up.
No.
On the other side. Any other questions? Wishing you all the best, in the population, all the best, Malu. So please don't make yourself a stranger. Come back. We'd like to have follow-ups, not only from you, but I invite all of our awardees, our grantees to come back. And you're a member of, you're one of our community partners now, African Services Committee, since last year when you first came. And there are others as well. So don't be a stranger. You'll be getting I need you to make sure that I have your email address as well. I have Paola's information.
Yes, definitely. I would be happy to reach out.
Okay.
Definitely.
All right, so let's see here. Moving right along, there are no other questions. Good vibes in the park. I learned about Avion Motion. I love that name. From our member, Heather Jason. Motion, if you are here, I hope you're here now. Okay. We're ready to hear from you. Congratulations and welcome.
Thank you for making time for me. I hope everybody's doing well. My name is Motion from Good Vibes in the Park. Good Vibes in the Park is a gathering that centers mental health and creates live cultural music and mental health experiences. I have a deck to share with you, but just to give you a little bit of background for Good Vibes in the Park, we actually started during the pandemic. It was important to create a safe space for people to be able to connect, especially around all the mental health issues that we were going through as a nation and then specifically as a community in Harlem. So I'll quickly just give you a brief synopsis of Good Vibes in the Park and the work we've been doing.
Motion, also, if you, this is for the other presenters as well, if you need to be made a co-host, I can do that.
Yeah, that would be super helpful. Thank you so much.
Okay, let me do that now.
So while Miss Henry does that, I just want you all to know, some of you I know are familiar with Good Vibes in the Park. We've actually received 2 letters of support and resolutions from our community board 9 in the past. I think the most recent one we received was actually last year, perhaps. I think last year or the year before. So our work has been really like deeply community impactful for a while now. And, getting the West Island Development Corps grant is super, super helpful to support the work we've been doing. But just to make it clear, we've been doing this work for quite a while. But I'm happy that we're starting to get funding to support the impact of the work. I know I don't have a lot of time, so I'm just going to quickly take you through this deck. So every picture you see here is actually from Good Vibes in the Park. None of it are stock images. So these are people in Harlem, St. Nicholas Park. Usually is where we have Good Vibes in the Park. In the last 2 years, we've activated Marcos Garvey Parks as well. Good Vibes in the Park, like I said, it started as a result of just like what, the country and specifically New York City and Harlem uptown community was going through. And we felt like there needed to be a safe space where people of color could gather without being profiled or judged. And we also felt like it was really important for mental health resources to be stressed and created. So these is just some background information. I can always share this deck with the committee at a later date if requested. More information about Good Vibes in the Park and our purpose, as you can see. And as I mentioned, it's a gathering centering mental health and affirming safe spaces, joy and relaxation. Its ethos and intentionality of using the outdoor structure of program creation creates a safe space for everyone to exist freely in spaces without constantly facing repercussions of their ethnicity or skin color. I mentioned we emerged in 2020. you can see with some of the, visitors and masks that were being worn. We move on to our, central purpose, which is creating safe spaces, centering mental health, affirming joy, and recharge and relaxation. This is just some of the impact that Good Vibes in the Park has had over the years. We usually have guided meditation, movement meditation, mental health practitioners. We have performers like singers, poets, and DJs. We have activations and installations. Our activations and installations vary. There's the ones with visual arts, but we've also had, even like a massage therapy. We also like create different activations that stimulates you mentally, but also teaches you like coping mechanisms of how to deal with stress and how to center yourself when you're and recognizing what your stressors are. We all go through stressors. It's about how we deal with it and how we connect and how we emerge. We have community, support from Manhattan Borough President, Community Board of 9 and 10, 9 being here, NYC Parks, Friends of St. Nicholas Park, Harlem One Stop. Our first year in 2020, we were briefly mentioned in Forbes. We've been mentioned in the Gothamist and Patch. This is a quick video that just really talks about, people who've attended Good Vibes in the Park and just saying how they feel about it. I know I don't have much time, but I do think this video.
How long is the video?
It's 3 minutes. But
You can, there's time,
yeah, let me quickly just play it. I might not play it to the end, but I think it's important to hear what
but
people.
if it's 3 minutes, that's fine.
Okay, thank you. Can everybody hear the sound?
So far.
My name is Higher in Motion. I really want to welcome you to Good Vibes in the Park. This is the time of the evening where you connect and you relax.
About safe spaces. It's about us connecting, enjoying each other. I came because I found on Instagram through a friend, and it was really amazing. We did like this really awesome guided meditation, and as you can hear, the music's really beautiful. It's really just a lot of great vibes. We're daydreaming about the details of your face. Is this knowing?
First time at Good Vibes in the Park, but literally ever since I've been out here, it's been nothing but good vibes. Came out by myself, but I knew that when I was going to come out here by myself, that I wouldn't be by myself. And again, it's the first of many more to come, all weather permitting. It has been a beautiful thing.
First time here at Good Vibes in the Park. Today was
Exactly, Summer Joy.
This is the first time I've really been outside, so to commune with my people, you know what I'm saying, and to perform, do what I love, and have people enjoy.
Audio only, it's not advanced.
Get loose,
All right.
and meditating and vibing, you know what I'm saying. Today was really great, and I'm grateful to be a part of it. The vibes, the beautiful people. This is an experience that you just gotta experience at Harlem.
I'm going to stop the video if I can find it.
Yeah, it wasn't advancing, but we could hear the excitement from the audio.
Yeah. Anyway, most of the video has been communicated, but this just shows you like our long-lasting impact in the community and what we've been doing in Harlem. And ultimately, I would say that our goal this year is to be live, back, and direct. Continue to do what we do. We usually have 3 editions throughout the summer, June, July, and August. This year, we're only going to do 1, and we're going to do it in June. One of the reasons is in the past, it's just really difficult through funding and resources to like stretch it across. So we want to make sure we put everything into one and continue to provide the impact that Harlem residents have come to expect and deserve. And as you can see, everyone loves Good Vibes in the Park. I really wanted to come and present to the Health and Environmental Committee because our work cuts across like, mental health and also like cultural programming. But I think it's really important to stress the focus on mental health and the impact that we have in Harlem. And this year we want to continue to connect with like, local organizations and do collaborations. So if there's any suggestions of organizations that you think the community needs and could really benefit from, especially related to mental health, please feel free to share. I will do the outreach and make sure that we can collaborate with them. And we always get a lot of people that attend. So we just want them to know that there are resources in Harlem for them and that we're here for them. And mental health is important. And it can also be fun to build community, and building communities are the core of what we do. That's it for me. Happy to answer any questions.
Thank you. I was thinking about the health fair, and we can talk. to see, once we find out what, Columbia wants to do, that might be an interesting place, for some, I don't know, maybe there's something to do special, or even if it's a video, you know, perhaps could work at the health fair. Monique?
Thank you, Chair. Quick question, your focus is only St. Nicholas Park, correct, in terms of Community Board 9?
Not necessarily. We were able to get a grant from Harlem Grown and Mellon Foundation the last 2 years, so we did do programming and events at Marcos Garvey Park. St. Nicholas Park is where we started, so it's sort of like our home park, and it's the park we activate the most. But if we have resources and funding, we definitely are open, and we have activated other parks in Harlem as well.
Okay, and then in terms of your schedule, it'll be up on your website. Unfortunately, you have to reduce from 3 months of activities to one.
Yeah.
I'm hoping that can change in the near future.
Yeah, honestly, it was a very big decision I had to make just because we were often in situations where like I think it's important the work we do for it to be 3 months of June, July, and August. But I'm hoping that as we get more funding, because in the past it's had to be self-funded. We've had to do a lot of fundraising and we've not really gotten grants. But sometimes we have. And so just thinking about how can we be more sustainable. So my hope is like if we can go to one this year and build a more sustainable model, especially volunteers in the community. I think that's the biggest thing that we tend to not have enough of. Then it's easier to replicate this the 3 months of the summer because the program is very consistent. We have the mental health resources and people will love coming to Good Vibes in the Park and always come back every summer and are ready. We have vendors, we have everything, but it's usually the capacity of like funding and people that can be sometimes really difficult, which is why we're scaling to one this summer. But I hope that, if we can change that, we wouldn't mind going back to three months, once monthly.
You mentioned Harlem Grown. I don't think there's a Harlem Grown in District 9, but there are in Central Harlem. Is that?
Yeah. Yeah.
So,
Oh, sorry. Go ahead. I didn't mean to cut you off. Please go ahead.
so the suggestion might be we have several kind of nice gardens. They're small, but because you don't have a lot of funding, they still could provide an opportunity at them and see what it could perhaps inspire people to enjoy the outside, gardening, some of the things that are good for our environment, and healthy, peaceful space. That might be an opportunity for showing expansion and getting additional.
For sure.
There might be 3 such gardens that could possibly work that are beautiful district.
Yeah, that's helpful.
Not big parks, but just
like smaller activations, and we've thought about that, and I think that in the future we'll re-engage and we'll revisit that. I think the funding that is coming from West Island Development Corps for the first time this year, in addition to other grants we've gotten in the past, my hope is that like once we have a system of knowing like having some form of community grants like yearly that we know to expect, it becomes easier to plan across that because even small activations does require some funding, but more importantly, you require volunteers as well. So I think probably what I will do, one, please share any community organizations you think we should collaborate with, but I will probably share with you when it comes to it in the next couple of months when we're seeking volunteers for people who might want to volunteer the day of. And I hope that we can use the committee's like outreach to be able to bring like-minded people because we always find that like a lot of people attend, they love it, but people are always down to volunteer. They just need to know about it. So hopefully you can spread the word for us when the time comes.
Any other questions for motion? I like your name, by the way.
Oh, thank you so much. I appreciate that. I do want to say before I go, I'm going to put our Instagram in the chart because if you follow us, that is usually the way that we announce our programming for the year. So this time around, for you to know what the date is and all of that information, if you follow us on Instagram, you'll find out. And I'm also going to put my email in the chat. And so feel free to reach out to me if you have any questions. But thank you so much, Ms. Henry, for having us. as well as Heather Jason. We appreciate all your support over the years. And also, all of you are invited. Like, Good Vibes in the Park is a vibe. So I don't know what you're doing now. We've not announced our date for Juneteenth yet, but we will. Mark the date, bring a blanket, bring the family, bring some friends, and just come and enjoy some good vibes in the park.
Heather's really good at reminding us of all the activities in the parks. So, but we're gonna be depending on Heather to give us that additional information as well.
For sure.
Thank you, Motion, and good luck to you.
Thank you.
I'm just looking at the chat, and Dina Lynn Collins, are you still here from the Coda Alliance? Dina Lynn?
Yes, I'm here. Good evening, everyone.
Hi, I know I haven't read everything, but I know maybe you can quickly, before we get to Leanna, talk about what you do. And you don't have a grant, do you, with West Harlem Development Corporation?
Actually, I do in collaboration with Forward. Yes, and Teresa and I, as well as my other colleague, Teresa Mateas, have joined together in collaboration for a wellness and intergenerational program that we have curated for teen girls and gender nonconforming teen girls ages 13 through 18. So that's the program that we are invested in. At this moment, we just finished our first winter session series of weekend programming, and we are on a break now, and we're coming back in March 22nd for the next spring session. And we have been meeting with these young people on Saturdays for helping them to become more resilient, for giving them a foundation of wellness in terms of I am an acupuncturist and massage therapist and a yoga instructor, Reiki master teacher, among other things in terms of the wellness piece. And we introduce them to holistic wellness. We've been introducing them into mental health, solving solutions in a calm way, helping them to learn how to relax and regulate. And they have been thoroughly enjoying this. So I am open to suggestions and also collaboration in terms of our registration for the spring session. All of the young people who regularly attended the winter session definitely want to come back for the spring session. And we have at least 12 spaces open that I'm hoping to fill. And again, we are so happy to be able to offer this to the Harlem community. And in particularly, we are looking for West Harlem young people. The other part is I'm very interested in finding out more details about your wellness forum. I think we met at the Columbia Wellness Forum last year. We were doing ear beads and energy healing and tarot cards and aromatherapy.
Yes, with Teresa, you were with Teresa?
Yes, I am.
Yes, okay, sure.
Yeah, and I'll be representing CODA in this space and looking forward to learning more about what possibilities can be collaborated on and how I as an individual, but also CODA as an organization can really support the Harlem community in the arts and health and in the wellness and well-being aspect of healing our community and uplifting our young people. Also, we are very intergenerational. We had a women's healing event that was very successful. And we are off opening our doors to also pregnancy health, prenatal health. So we are definitely in alignment with everything that has been discussed in the forum this evening. So I'm excited to be here and to meet you all.
Well, you should, that was your presentation, or would you, since it was kind of not planned, and would you want to come back next month, if there's additional information?
Absolutely. I will be able to have a flyer with a QR code and for registration. We're really actively doing outreach in the Harlem area to have more teens involved in the program. As I said, we have enough spaces, 12 spaces. We are collaborating with Brother Sister Soul. So there's a lot happening in the way of our health and wellness program as it relates to the grant that we have and the work that we're doing with Forward Inclusion. So I'd be definitely happy to come back and talk more about that and see.
Can you do it in conjunction with Isabella with Forward Inclusion? Because is it one, you both have the same grant, you're partnering or collaborating under the same grant?
I'm
Isabella
collaborating.
did something to me, so I'm just wondering if
I don't.
if it would be more relevant.
Well, my connection with Forward is through Jolisa, who is the director of Forward Inclusion. And, together with Forward Inclusion, the CODA Alliance was able to acquire the grant. So she's the person that is probably communicating with the grant folks. But
okay, because I want to see how it's listed among the grant recipients, and so we can talk about that further offline. Additionally, Wendy Millette, I'm not sure if Wendy is online now, but we last year you may have also gotten a chance to meet the Tall Omega Charitable Trust Foundation. They were also at that community event. And they're one of this year's recipients as well. And so that would be a collaborative partner, you two could talk, and I think you have, Dina, dropped your information, and perhaps Wendy, you can drop your information back in the chat as well. But let's see how we can do it. I want to make sure that we get the awardees, so this year's awardees in, and I know that deadline is coming soon, so that's, I want to make sure that we get them in. And then if there's a way where you fit this grant year, we'll definitely get you in. Otherwise, we can try to schedule something after that. I think probably March will be the last time before there were, for the reports that they're due to have in. Okay?
absolutely. Thank you so much for the time.
Okay. And also, Dina, if it does work, simply send in your attendance form, motion. If you can email me your attendance form, as well as Muluso as well from African Services Committee. Email those tonight. Maybe I could get them signed if we get them in time. Okay, the attendance form that you did your presentation. Okay.
So where would since this is my first time doing this, where do I?
Okay, your situation might be a little bit different, Dina, so we can talk offline.
Okay.
Yeah, your situation might be a little different, but the others have my email address from the invitation to speak. Okay. So I'll be able to talk to you, and if it is and can be doing now, that'd be great. We should also mention that Forward Inclusion was first introduced to us through Shanika Wilson from our CB9 Youth Education Libraries Committee. and Deirdre. But it was Shanika who pulled that off for us last year at the Public Health Forum. Okay, Liana, are you here?
Yes, this is Iman. I'm speaking on her behalf for the Plant Powered Metro New York.
Oh, yeah, Plant Powered Metro, right. I haven't, okay, so what, please drop your name and information in the chat, but repeat your name again.
My name is Iman Ferris. The community empowerment coordinator. I'm just adding it to the chat right now with PPMNY.
Okay, Iman, welcome. Will you need to be made a co-host?
Yes, please. That would be great.
Okay, I just did it. Okay, so you're a co-host, and thank you, welcome, and congratulations.
Thank you. And I'm sorry, I was having trouble figuring out the camera on my laptop. And so I was trying to join from my phone, but it looks like my phone doesn't want to connect. So you guys have this beautiful presentation. But super excited to be here today. We were awarded the West Harlem Development Corporation grant this cycle, which we're really excited about. And just to kind of give you a little bit of an overview of who we are as an organization, we were founded 6 years ago, so we're still relatively a young organization, and really the core of the work that we do is building a movement for food using, for health using food and nutrition. And when you take a look at our mission is really to empower local communities to find better health and overcome chronic disease through whole foods, plant-based diets. And the resources that we offer are evidence-based education, resources, and support to be able to create community and inspire change. I think whenever we're going through like a health change, community is really important because going through change isolated can be hard. And so kind of building that community along with the education is a key part of how we do a lot of our work. And then despite us being a young organization, one of the things that we're really proud of is our network that we've been able to grow over the last several years, which is largely volunteer-based. And so a lot of our volunteers come through, touch our programs through the different programs, whether it's like a day workshop or our 21-day Jumpstart program. And they love the work that we're doing and tend to commit to us long term. So that's one of the things that we're really, really proud of. And when we take a look at the work that we do, we believe in like a lifestyle medicine, and we focus specifically on the whole food plant-based nutrition aspect, though we do believe that there are many aspects and components to making us healthy. But with Plant Powered Metro New York, we focus on the whole food plant-based nutrition. When we talk about whole food plant-based nutrition, we focus primarily on 3 things. So number 1, primarily eating plant foods. We really try to emphasize whole foods, which is like unprocessed. The more that it looks like it just came out of the ground, the better that it is. And then also a focus on keeping dietary fat consumption low. When you remove animal products from your diet, that naturally kind of comes with it. And so we try to create an understanding for our participants or the members that touch our programs. So these are like the 3 food keys that we emphasize to living a long life or a long, healthy life. And when you look at the standard American diet, or the SAD diet, as we call it in our presentations, this is like a majority of where people are currently getting a majority of their calories from. So we can see here 56% of it is processed foods. So these are, whether that's fast foods or just packaged foods, over 50% of our diet comes from that. And then when you look specifically at animal foods, that makes up about 1/3. And then only about 11% of our diet, on the standard American diet, I should say, comes from plant food. And if you can kind of see within the plant food shading, there's like it's kind of split in half. And they actually found that about half of the vegetables of the 11% is actually potatoes. So you might be thinking like fried potatoes or French fries and things like that. But a large percent of the plant food here that's represented is potatoes. And when you think about health, fiber only comes from plant food. fiber is not in any of the animal products. And so that's something else that we try to integrate. When we talk about plant food, we're talking about vegetables, fruits, but also legumes, nuts and seeds, and whole grains. So this is the plant-powered plate. It looks very similar to the My Plate that Michelle Obama came out with when she was in office with Obama. But ours is a little bit slightly different, obviously, because we're plant-powered nutrition. And so we split the plate into 4 quadrants with fruits, grains, vegetables, and legumes. And then we also really try to emphasize water as a main source of hydration. And then when we talk about like vitamins, especially just living in New York and the region that we're in, vitamins B12 and vitamin D are like really the only 2 supplements that we know that we need to supplement, but it's not really a feature or a requirement when following a whole foods plant-based diet. And then also talking about the different sources of omega-3s from flax seeds, chia seeds, and different types of nuts. So we have like walnuts here, for example. For Plant-Powered Metro New York specifically, we have 3 different audiences that we're really, really focused on, especially looking at the West Harlem community. We understand that there are large health disparities, especially in communities of color. So a large focus of our programming and when we do outreach is really targeting Black and Latinx communities because we find that that's where there's highest needs, but also an openness to listen to the information that we have and an interest in trying out or experimenting with some of the diets to improve their health. And then the other 2 key communities or populations that we really focus on are healthcare system patients and employees. So not just people who are, going through the healthcare system, but also people that work in the in the healthcare system. Not only are they stressed and experiencing different negative health outcomes, but also as like key educators when they're implementing different practices with their patients. And then another key population are older adults and people working with older adults as well, because we know that they also deal with a high number of chronic diseases and different illnesses that as you go on later in life. So specifically looking at the West Harlem Development Corporation grant that we received, we have 3 different program deliveries or 3 different components that we have discussed. And we actually just had the first component this past week. We partnered with Columbia Center for Community Health. They have their own community health workers that they've been training. And so we provided a 7-hour day-long continuing education training for the community health workers. They're really focused on how to prevent and possibly even reverse chronic disease through plant-based nutrition. And so throughout the day, we had a number of speakers come in. On the screen here, you see 3 of our volunteers who participated in our programs and were able to actually reverse a number of chronic diseases that they've been experiencing for years. And they came and, kind of just shared their story with the different community health workers that were there. And that was like a really great Q&A panel that we had. But in addition to that, we talked about nutrition science. We did a great activity kind of like simulating grocery shopping and label reading, different technical skills that you can use in your everyday life to understand the different foods that you're consuming. And then we also had an amazing chef come in who did a food demonstration. And then also as part of the grant, we actually were able to cater lunch, which was a whole foods plant-based lunch as well. And so the community health workers got to kind of taste what it is to eat a plant-based lunch and different snacks throughout their day. And then one key piece that we integrated as well into the seminar was really integrating their role as community health workers. They're ambassadors for health, they're ambassadors for nutrition, and they know their communities best. And so we kind of reflected at the end, what are some elements of today's or of the seminar that we talked about that they can kind of share with their community, but also what are some barriers and additional resources that we can supply moving forward. And so thinking about the other upcoming activities that we have related to the larger community in the West Harlem area, but also specifically working with the community health workers. We are trying to coordinate a health screening or a vendor table at the health screening fair. I think that's what you guys were just referring to in the previous presentation, but having a food demo, an opportunity to connect with people there, And then also specifically doing further education for the community health workers and possibly even being able to open this up to the public as well. But we have a Food for Life curriculum, which kind of dives in a little bit deeper again into nutrition and offering technical cooking classes as well with a focus on cardiovascular health. And so this are two of the upcoming programs that we have coming up in the spring. So that's all I have to share.
Dr. Janabi called in, I think it was December, and mentioned this, some aspect of it. Right, she said that was one of the things that they wanted to talk about and be involved with our health forum. I mean, that part sounds exciting because we were trying to get someone last year who could do some food demonstration.
Yeah.
So I don't know how much that costs because you bring in the chef, you get the food, and I don't know how many people we would have or what a demonstration, what size demonstration would work for you. Or if you would be able to accommodate the different foods, people coming into the facility. But we need to talk about that. And I know she was very eager. So now with your speaking, I'm pretty sure this may be since it's the community health connected to community health, I'm pretty sure you're the group she was talking about.
Yeah, definitely. That's, I was like, I'm not sure if it's like through you all or through Columbia, but yeah, we're working directly with them. And so, yeah, I think we are the organization that she's referring to.
Yes, she made a point of it. Okay, and it sounds great. And it sounds exciting. I am a little hungry. Yeah, it sounds like an excellent program. Are you connected to BioBiz?
The bio bus?
Mm-hmm.
You're asking them.
It looked like
I wanted to ask if they.
the setting was there.
I want to know if they work with Harlem Grown.
Well, are you working? That's a good question. Are you working with any other community-based groups or?
Yes, we
programs?
are. I'm relatively, let me take a quick look at my notes, but we are working with a couple other organizations in the neighborhood. Let me just see. We did run like a Jumpstart program, which is like our dietary change program with Somos Community Care, which is a pediatric center on 135th Street. And then we've also presented a couple of our Food for Life nutrition and cooking classes in Spanish in collaboration with the Mexican Coalition with a church on 142nd Street. So we're still kind of developing some of our programming in the area, but we're definitely interested in connecting again with, especially like community facing organizations, but also with different like healthcare systems. And again, connecting with people who have like a little bit of influence of change in their communities.
The church on 142nd, is that the Catholic church between Convent and Amsterdam? I forget the name.
It is Our Lady, yeah, Our Lady of Lourdes
Our
Church.
Lady of Lourdes, yes.
Yes.
Very nice. Okay, very nice. That is CB9. And the other children's organization on 135th Street, where are they?
The Somos Community Care, so I think it's a pediatric office, I believe.
What avenues,
I don't know it off the top of my head, but I can quickly look.
Oh, both are certainly CB9.
I don't have that information on me right now, but she did mention that it was like a pediatric office.
Mm-hmm. Okay. Any other questions for Iman? Really, very interesting. We'd love to drop. I think you did drop your information in the chat.
Yes, I dropped my name, but I can drop my email. I can drop my email as well.
And right, email and phone number. But I want to definitely be back in touch in reference to. And I can follow up with Dr. Actually, I called him last week, but I think I did even this person. But anyway, hopefully I'll hear from her. I wanted to follow up. In anticipation of the meeting that was supposed to take place with the representative from Columbia.
Mm.
All right. Thank you so very much. It's exciting. Good luck to you, and we hope to have you come back. And then I want you to think about how much, we do the community health fair.
We will, not if, but
Well, yeah, that will take place. And then there's another, the public health forum too, which we may have to select another space because that's what's part of what's happening. They're getting jammed with so many people want to use the facility. So but we can talk about that. Okay.
we also have city.
Don't forget about city. Right. Any other questions? Any hands I might have missed? Okay, hopefully not. Thank you so very much again. So we'll move ahead. Christelle, I had asked if she could come. I won't. Hopefully she can come in March. Right now, this will be pretty much on schedule. Last month we had a presentation from a gentleman who further informed us of Project 2025 and its alarming repercussions for the community. Most of us were familiar with Project 2025, but it was such a big document, some 900 pages, so we may not know everything, but one thing for sure is that most of it is dismal, would be done as part of a, the express will of just a small group of people, but not necessarily something that is legal and that the people may really want or be questionable as to whether they voted for that or not. So there's so much that's going on. And then of course I got the letter that I did share with the committee about the temporary pause from one of the DOH divisions. But when I talked to a representative from Columbia, they're listening and involved with it now in various upheavals that are going on. And he made a point of letting me know that he was exactly the person that needed to present. And we're expecting to hear from him March 3rd. He has committed his time to us on March 3rd, dealing with the new administration's turn away, what seems to a number of people turning away from democracy and from the privileges and freedoms and benefits that we aspire to as Americans and had always deemed that would be here for us. So he will be speaking to us on March 3rd. I'm going to get a broad mailing out. It would be great. Wanted it to be done as a chat. Because things are up and down here, that there's facts and fact. Thank goodness, pauses and change. So he felt that we should give it a couple of more weeks to hear what's what. By that time, we'll have more of an idea. But of course, this administration, the new president signed 200. I think it was 200 actions.
Executive orders. Executive orders.
Executive orders. And so Yeah, I'm really concerned about it, and it seems like I'm on 3 different chats, and we are just talking about this stuff and getting information. And I'm always so happy to know the legal action that's being taken. Some things, of course, may not bear out legally until this administration is over, but I'm hoping that certain other things are acted upon more rapidly. This is crazy. But I know my personal view is that we all are called to action. We may not speak up and say a whole lot in a meeting, but listen to your legislators, especially those that seem to, or even if they don't seem to really be proactive and active in their reports, they need to know where and we as a community. But we have to be proactive, I believe, and in my humble opinion. But there's letters that can be written to the editor or to whatever newspaper or outlet that you use. Attending meetings, make sure we're all on the same page. Even if our ideas may vary somewhat, as long as we come to something close to similarity, we can fight back and serve the primary principles of our democracy, what's going to benefit the whole. But I mentioned, I know I've been talking to a couple of people, in particular, Edwin, in reference to a resolution related to NIH, National Institutes of Health, and I know Columbia is, that you're definitely affected because some funding will either be totally stopped. I'm not sure how it affects the other grant years, how long those grants were for. But that affects our communities too, because we were going to, at one point, make some recommendations in terms of how we felt impacting our communities. NIH funding could be requested or studies could be. World Health Organization, I believe, and so many believe, is very critical for information sharing and knowing what's going on. Viruses, even though we may hear about them one place, eventually rapidly go all around the world and can impact all of us. How do if some of the others of you have an idea what you want to say about that, I can certainly get this information. And actually the person that I am speaking of from Columbia is Dr. Olajide Williams. And he's in talking about this, he said, I am definitely the person. Because he does more than, there are a number of things that he does. And reaching out to the medical community.
So he's the one that will be presenting
March 3rd.
Okay, not the other person.
Well, I'm not saying that he's the other, Ross, I would like to have.
Was it Ross that Padmore had suggested last month?
That guy spoke last month. What was his name?
I don't recall, but he was a professor, and I'm sorry, I didn't mean to cut you off. He certainly didn't get a chance
I hope he comes back.
Yeah, he didn't get a chance.
He wanted an hour and more that wasn't available to him.
Correct.
But he did speak for about 30 minutes, and he had put together a nice presentation.
No, I understand, but that's not who you're talking about now.
No,
okay.
But he would be invited. As I mentioned, it's going to be an extensive mailing. And I emailed him this week also. Well, but at any rate, we should know a whole lot more and what the pushback should be. I also would like for Ross to come. He may not. Generally, if he doesn't do it at Columbia, generally, you attended, with Monica, I remember he had 3 government officials prior to Project 20.
So my question is, if we're gonna extend this broadly, and the topic is, it's a big topic, are we looking to move to space for where we hold it? If we want,
can find it.
Right. I mean,
wonder how this can grow. But anyway, we'll have next door to us. I'm not sure how big that can grow. Maybe 25. Well, we had
You can
20
ask,
people there for.
we can ask Yutha, but I'm just saying if that's something that we're thinking about, we should
Mhm.
plan now.
So, anyway, so we'll see how that materializes. He has definitely already.
Dr.
committed.
Williams, okay.
And there may be a couple others that he would invite as well. Because that definitely impacts our. Are there any concerns right now that you want to express that we could specifically delve into or look into or inquire about? You can always send me an email, because I'm listening to things and, I certainly don't know everything. There's so much that's being thrown out there. One of the things I'd like for you guys to do is be part of the CB9 Connects, because let me tell you, a lot of information comes up from various sources. And I did send that out as an email to the link for joining. And that was founded, but Pat Moore's part of that, and Edwin, I understand I'm one of the founders of that too, I come to find out. But anyway, there are a number of people from the community, and really, strictly information, not everything being totally subjective, but just getting real hard. So do you like that topic, but if there's something you think about and want to add to it, just please let me know so we can be sure to cover as much as we can. And if it needs to be made into a separate form, we'll do that. One of the things that came up, and I know Victor's working on it, and this came through one of the chats, related to immigration and housing. I believe that they're trying to work on larger form with several of the other community boards. Michael.
Right. So obviously the theme is happening of immigration and concerns, especially because there's large Latino and West African community in this area that feel like they're being targeted as well. Like essentially.
They are being targeted.
I'll get ready to change that too.
They're here.
They are.
They've been here.
Even though there might even be European immigrants here, but they're not as targeted.
There were studies about that a long time ago. The Irish made up like the biggest undocumented group for a long time.
Interesting.
But anyways, point that I was thinking about, and I think this would have to be a collaborative approach. In California, there's a law that was passed during the first Trump administration, which doesn't allow state officials, state or local officials to cooperate with that. Now, I think there is a major hole in that, which are island agreements. But perhaps New York State can have a law very similar. ICE can just do that. I used to work at the IRS. State of California was not holding my hand. He was not holding my hand. And right now, Eric Adams is actively on the phone with ICE. And there's videos online of him talking with ICE agents. And ICE agents asking so talking to Eric Adams today is our local officials have to be helping and doing a federal job.
They should.
We pay taxes for that.
I agree. I think something was happened today. I didn't get a chance to participate. I think it was some Zoom meeting today focusing on what transpired a few days ago with ICE going up to a local school.
I was on that meeting.
Yeah, Mary, you were? Yeah.
It was a bilingual meeting. Adriano Espaillat was on, the congressman.
Okay.
And it was basically just telling everyone what to say in what situations. It was translated in Spanish, so whether you are a migrant or a bystander, what to say in the situations, what to ask for, what to look for. I expect there's gonna be a lot more of these
Yes.
presentations. It was presented by Make the Road.
Okay.
Let me see if I can put in the chat.
Right, because that would be our second one, because remember, we have the
Thank you.
one that Cheyenne talked about, so you with the second one.
Yeah.
And then, but Michael's at the same one. Your point was a little different, though.
Right,
Your
that's-
point is, you're saying that you don't think our immigrant community is getting the support from the administrators of the city,
And
particularly
the
the
state,
mayor.
yes.
Right.
Yeah, that's what you're saying, and there's been a lot of talk about that. We know what the ulterior, or we suspect what the ulterior motive is for that. That's why we have to populate people who are unencumbered,
I just put it in the chat.
Okay.
Thank you,
It's a
Mary.
deportation defense manual from Make the Road New York, and it just basically, it tells you everything you need to do in this situation. And there's like a video, like train the trainer workshop and all that.
Okay. Well, Tim, then
I want to say that the DA's office, Jocelyn, I want to say they were on the call as well.
Yes.
Okay. I forget Jocelyn's name, but you said the DA's office.
Yeah. They come to our meetings a lot, and her name is escaping me, but
Yeah,
she's
right. We pretty
comes
much,
to our
I
meetings
see
a
her
lot.
card, but
They're on it. I like that office. They seem to really be on the pressing issues. Cool, Tim?
And when we had the concern about Homeland Security being around PS 153, we reached out to the superintendent for District 6, and we've got a response. We're waiting to meet with them. So these are city agencies, and they're responding.
Yes.
Did they show up to stand there
We're
at
told not to allow them, they're not letting anyone in the schools.
Right.
So that's a city agency, and they're not allowing ICE in their buildings.
Right.
That's the issue, is that there's almost an erosion of due process, right? Where imagine that you just need, Congress recently passed a bill where you just need mere accusation of committing a crime
people telling on
to
other
be
people.
grabbed, to skip due process, jury trial. Imagine that same principle happens in criminal cases, where the government can just grab somebody off the street without due process, nothing, and immediately just held in jail.
That's ultimately what they want, what they're doing with the FBI.
Yeah, you're right. So
yeah, this is, if things seem calm around New York, but it's like, there's so much beneath the surface. People are stressed out. So, but what you were getting at, so what we can, part of what a resolution could be, Michael, it doesn't have to be long, but just say, we really need our legislators to know the law, our city administrators to know the law, and state specifically the law that you just mentioned, and say, we want you to act on it. We want you to, represent us.
accountability.
Be accountable to us.
Yeah.
So we need, if you could write it, so it doesn't have to be, it could just be 6 points, less than that. Or maybe just 1 point to say, look, we need you to be here for us. Because the majority are not criminals, or violent, whatever the, number, why they're doing this so quickly and just making a blanket statement. You think everybody is like, just a lawbreaker, if we didn't know better. And there are a lot of people who don't. Look how they.
Hi.
Oh, hey, Edwin.
I was gonna
Hi.
say,
So-
quick,
Hold 1 second.
I was gonna say really quickly, I went to an event last week, the inauguration for Jordan Wright, and every local official that was there, I alerted them with Barry about what transpired at PS 153. And, we said, we want you to be aware that this occurred, this is alarming, and we're not gonna stand for it. So, we told them, And I know that the person that works in, and I even mentioned it to Yusef Salam, who, this is, the he has a small.
It's the area way.
Right, so, they said they were gonna respond and we'll follow up with them, so I could tell you to their face, we make them aware. And so, we have to keep, as
We
you
have to
said,
put it right.
pushing on our legislators.
Right.
State, local, and federal, and let them know that at least in our TV.
We want them to fight.
Yeah, they need to
We want
fight.
them to fight, because that's what this is, we want them to fight. I'm sorry, Clotilde, did you
Yes,
say?
yes, ma'am. My question was about the French-speaking immigrant. Yeah, because you spoke about a brochure and you spoke about several seminars which were in English and in Spanish. And I know because we run a nonprofit of 149 and Convent for the last 20 years. And we do have a lot of French speakers. And usually they really don't speak it at all. The parents don't speak it. And they probably have children that
If the city translates, they have it in French and Creole French. They can definitely do that.
So
That's one of the
You're right.
popular ones.
So we have to also make sure
languages.
there's that translation as well.
Edwin,
I was
that
gonna
would
say, Laquila, the way it looks like from some of our politicians is that they're trying to walk a fine line between those who support the current, status of the president, right? Remember that, you had a very large percentage of folks in our community who favor some of the stuff that Trump is doing, right? And what you see that exactly same thing with our politicians. Are they just trying to walk that line between not saying too much and saying enough? And I think, like you said, we have to advocate for those who are voiceless, right? Because these folks are contributing to the economy. To put a blank statement, the data shows a completely different story than what we are hearing from the White House. And you see what's happening with the CDC. The takedown of those guidelines to treat patients and vaccines, that is exactly what happened in Nazi Germany. The first thing that Hitler did was burn the books, try to erase some of that information that society had access to. And we, like you said, we have to fight back, push back on these politicians, because if they're not going to do it, then let somebody else do it. And we get it. It is a very stressful job for anyone to do. And if you're not caught up for that, then let somebody else take over it.
exactly, that's what we have to really elect people to the best of our knowledge who are unencumbered. Like if you have some lawsuit or you did something illegal or it's okay. So all right. Oh, that was what you were gonna add. Okay, so were there any other comments on this? Because I think, Michael, can you just,
Yes.
it doesn't have to be perfect, because we
Right,
can all
just
look at it.
one case.
Do it this, if you could do it this week and we get it okay, then maybe it could go before the executive committee next week. But we would all, on the committee, have to vote on it, so that's one thing. And take what, some of what all of us have said there. As I mentioned, I know the NIH, I have concerns about, because that directly affects our community because Columbia gets that big grant. But if it's cut, that's gonna impact our community. Now, anyone else who's online on the Zoom call with us?
I don't know.
I would,
My thoughts are
Miriam?
all politicians have kind of let us down slowly throughout the years. It hasn't just been one party or the other. They've all been working for votes versus working for us. And I feel like this is an opportunity these next 4 years for those of us boots on the ground to start organizing, mobilizing, like we've never done it before, and really create our networks and do something new, because this is broken. It's not even of like, let's have them fix it. What are these politicians going to fix for us? I mean,
we gotta let them know.
We gotta let them know, but then we also gotta start building.
Gotta follow up and build. I like that.
I agree with Miriam, because what we see is a lot of superficial sort of community, events. I think that, look, why is any politician handing out food from their office? That is a clear conflict of interest. Why? People are going to associate you're giving me that food, that comes from you. Many folks in our community think that that is from their budget. That is not coming out of your dollars. That's taxpayer dollars. We have enough community CBOs in our community that can distribute that food. So what we have is a lot of superficial events that they do instead of tackling the real issue. Housing, the harassment that's taking place from these landlords.
Right.
Nobody's doing anything. It continues to decay. I'm living that right now with Alma Realty and the whole situation with the noise.
When I was with Godard, I mean, the amount of buildings in our community that are like, just people are under like inhumane treatment is unreal, but we don't hear about it.
Yep. Because Remnig is the number one, donor to many of them. And
that's driving so much bad health.
Yep.
Like I like housing and health. We're gonna scream this till we have no voices, but it is connected.
Right. Exactly. Well, which
if
brings
it's not the unhealthy home, it's the stress of making your rent. Like it's really hurting people.
Yeah, and the other thing, Miriam, that they're using, they're weaponizing, the living conditions to try to get folks out. In my building, Alma Realty has used noise to try to make the life of the tenants that live in hell, so then they can try to get out. And it's a cat and mouse game, right? And the tenants are the one living through that.
Well, if we get hopefully can we have 10 minutes? We just have a resolution. Okay, thank you. In light of all of this, I'm gonna see with Michael's minutes, maybe some of this discussion will be added in from Dr. Williams and whoever else, maybe one other administrative type will be at that March 3rd meeting too, where we can get some of our sentiments expressed. But certainly the resolutions, and we've worked on resolutions that are really progressive already. And here they are. Yes,
I just want to add something. Like for a resolution on this is like, I think what we really want to stress in this is that yes, we have all these national issues, but we need you to focus on the local issues. Like
yes,
and this is a strategy coming directly from the top, to distract us, divide us, so that we don't focus on healthcare, on housing, and the real issues that we have.
And education, Miriam, District 6, we have a lot of, inequities compared to all the other districts.
Like I can tell they're trying to distract us. This is
something we don't know what else is going on, or maybe we do, but something else is going. There's a bigger, certainly a bigger picture. And it's at Community Sciences Institute from Saturday. It's like this one woman said, we're on a boat and we're doing one thing, dumping water out, but meanwhile, while we're dumping water out, somebody's drilling holes elsewhere in the boat where we're going to sink. So this is chaos. We have to see it right now. It's chaos. We got to be able to try to figure out something. And we got
to keep our focus on what we need to keep focused, because they're going to keep trying to distract us.
Yeah,
exactly.
And we need our politicians to stay focused on our district and our needs.
That's right. So
got it. So let's see what we can come up with on that. And did you all get a chance? It was a last minute thing last month when I decided to get up and speak on the mental health component. I had seen and heard a lot of commentary that morning, as well as the day before, about Eric Adams. And I actually liked what he was presenting in that mental health picture, the amount of money being devoted to it and all that, aside from some other things that we may or may not like, but that mental health grant or bill seemed to be a good start. And the governor also has started something similar, although of course we have to always watch it. Hers was, I didn't hear much about a dollar amount. I could probably go back to the drawing board. But I know that her emphasis was getting a lot of police on the subway. I'm sure politically she's being hit and looking forward to what she has to face in her election by what people are saying about how unsafe the subways are. So at least with what she was doing, she focused on the subways. But again, that's important. We have to be careful that, because that could also lead to another kind of problem in terms of emphasis on the subways. But still, they're all trying to tackle this mental health component. The mayor's statement and his programs do include housing. They include housing, maybe not totally sufficient, but it is a way of tackling housing. I believe that they're combining some of
Is that
that.
the housing, the yes proposal, the power?
That's what I was just saying. I think some of it includes the city of yes.
I think that
one
thing, Laquita, when we speak about housing, there's two phases to this, right? There's one that is, building new housing for those who need it. But the other is to protect those who are living already in some of these, apartments that are rent stabilized or that live in NYCHA. And what happens is that they try, it's not a mutually exclusive situation. They have to address both because right now we have this worst landlord list that comes out every single year. It looks like it's just a press conference for somebody to get, clout. These politicians, how many of them have come to the buildings in the community and see what's going on? None of them. They only send you whatever they have. Oh, vote for me, send me this, and then after that, they're completely gone. And the reality of people doesn't change. So these new buildings, they get a 529 tax break, which is our tax dollars that we're giving them. And then the community is left with a few nice buildings. Look at that building, I think is on what? 152nd or 153rd, Marion, the big one? $4,000 for one bedroom, for a studio.
That has come up in our community board this year quite a bit.
Exactly. So, how much has that benefited CB9 and the reality of the people who are native from here?
So right now, this is a strong resolution. I want to publicly thank Edwin because once I was talking about all of this, and most of the information comes from what the mayor did propose. Okay, we can go for this. We can go for that $50 million 5-year plan, and we can add certain things. So I'm hoping you guys have had a chance to look at it, and we can move forward with it. That doesn't mean that it's totally satisfactory, but we have got to start, or continue this fight, and this allows for a good continuation. So I'd like to, all of you got it. Even Miriam, Monica, and Edwin helped really write this. So and I want to thank you for jumping in. And yeah, Miriam, you were one of the first ones to respond. That's what you were the first.
It was really good.
Yeah, you were the first, and then we heard from Monique and everybody. Justin wanted us to focus more on, add some more things to housing, but I don't want to be the housing committee. I think we have enough in here for them to work with. But let's just get this off the ground.
Right. So we're presenting this next week, correct?
To the executive committee. Can I get a vote on it? All those in, any other comments on the resolution? first of all. And Heather, I know Heather, you were looking at wanted me to look into some other statistics. The statistics I did pull came from the mayor, what he got from the city. So those were like 3 or 4 statistics. For right now, it's that whole concept that we're doing. Gotta do something. I don't want us to get too bogged down where it holds us up. For like, they gotta, just do something.
Right.
We can always add. We can always add. Their motion.
Yes.
There's some more discussion. Okay.
I motion that we present this resolution to the exec committee.
There's, thank you.
What is it, February 13th?
I second.
And Miriam seconded. All those in favor? I should have just said, somebody should have said, I'm surprised I didn't hear you.
Unanimous consent.
You're right.
We need Walter.
Yeah, Walter. Right. Okay, so, yeah, he gets it out first. Okay, so.
It was the unanimous consent.
Right, and that first came from, oh darn it, he was one who works on transport, I'll think of his name, wonderful guy, used to be on our board. Okay, so we're all, set. Any other new business? I talked about, resolutions, we're gonna have new business, like Michael's gonna do his best. I know you're in school, you're doing a lot of stuff, but it's coming from the heart, just whatever resolution, we can always, whatever you put down, we can add to it, I'm sure it'll be fine.
Yeah,
Okay.
Michael, and whatever you have, I always help out and try to look at the data.
Yeah.
And try to include it into the reso, so it doesn't have to be perfect. You have a whole committee. I think it's great that the committee is putting out these reso because as much as sometimes we think that they're not, being heard, this is the pulse that politicians pay attention to. And it goes on the record, right? What we have said.
Exactly. It holds, we just gotta make sure they get out, and all of us will know the resolution. That's why I keep the list as part of our agenda. We can always say, okay, we know we did a reso on this, we did a reso on that. And we run into these politicians, especially now, because it seems like everything's being thrown at us. We've done a lot. You gotta remind them, look, this is how, I would try to get all the resos out, some of the ones that were signed out, so that we can actually, look at them as a group, have a report together. All righty.
I think we're done. So I make a motion, we conclude the meeting at 8:42.
Our motion lady this week, our vice chair is on the case, 8:42, without,
What's somebody second that?
Unless it's opposed, may I have a second?
Good night, everyone.
Was that Miriam?
That was Miriam.
Second.
Good night, everyone. Thank you for
All
the
right.
great conversation. Laquita.
Okay, thank you. Who was this? No, that's Miriam.
That was Miriam.
Okay. Yes, Miriam.
I think she
No.
said.
Good night.
Oh, good night. We'll take care of that public.
This is Dina Lynn. I just wanted to know from Laquita, how do I get in touch with you in regards?
No, that's Tina. Email is Laquita. Oh, I should drop. Let me drop it in the chat real fast.
I think it was.
Oh my goodness.
I didn't have
Let me go up here. Scroll down. Where am I?
Last time, right? Last one?
Yeah, I mean, I didn't present. I've just been sending emails to everyone and I'm trying to just get into like.
Okay,
all the spaces to know people. And
He's
not
been here
to you,
before, but I'm
but
trying to
to
remember.
other-
Okay.
I went to the youth and education and libraries and I've been to the general board.
Yeah, that's right. I know I physically saw you, so.
Hopefully this will
Welcome.
get the information real fast. Let's see, Tina, you got it in the
I
chat?
got it. Thank you.
because we're gonna close out, it's recording now, but we're gonna close out shortly, and I hope that.
Community participants like that.
I know I missed some things that were in the chat, but
I got it. Thank you so much. Have a good night.
Okay, you too now.
Okay.
Bye-bye.
Good night, everybody.
Yeah, and remind me of your name. Denise? Denise, okay.
Hey, Denise.
I remember. She was at the community board meeting. I finally lit a fire. Yes, the Family Enrichment Center. That's right. You're brand new. Are you in the arts community? No, I just came from the arts. I'm a team of one right now, so.
Oh, you left, some of this guy.
Oh. I'm wondering.
Was it copied here?
No, I'm wondering how we can help her increase. We came to the general meeting last month to sit in. I don't think we had a chance to present. So we should get you present.
Public
session.
Public session.
And it's really important because this center operates off of a code design. So I need community members that will be part of the community council board, and that's how this center works.
Do you wanna give any of these guys a flyer?
Yeah, you guys wanna take a flyer? Just
We
information.
8:42, 10 minutes. Okay,
we're done.
What I wanted to see is if anybody did send their.
Yeah, I remember. Is your name on here?
Yes, it's right at the bottom.
City's force, and then it's so you're a part of one hacker?
And I have some that I would not do, like.
I think I hit all. I think I did.
That's fine.